Okay, dear colleagues, welcome to our Pmnch webinar. This is set to be 60 minutes. We will try to give you an update of the governance reform as well as the Executive Director's report, which, as some of you may know, has been now decided is going to be shared wider and also made available on a webinar instead of at the board or the executive committee meeting. It will instead be sent to them for their information. So this is an opportunity to really engage with the broader membership of Pmnch, which I'm really delighted to do, and also have then actually an opportunity, which was not really possible to do at the executive committee or at the board meeting, to have opportunities of questions and answers. Please feel free to come with questions and comments in your in the chat box, and we will also capture that and either address them during the meeting or webinar, or at least afterwards. We are recording this to make it available to members that are not able to be with us today, so that we get a broader reach with the message and also some of your questions and answers, so that we can facilitate a better inclusion of our membership at large. The agenda today is to go through the governance reform, and later on then to go through the executive director, which is an extensive report this time because of the fact that the executive director's report includes actually the completion of the 2020 report last year, and the explanation for that being so late is because of the WHA. As you know, we're the hosted agency. We're hosted by WHA, and so our financial report gets actually approved with WHO's financial report during the World Health Assembly in May. And so it's not actually finalized before June, July, and that's why we have then included 2020 as a report in our June, July executive committee or boards earlier earlier in the years. So we will give you a highlight of that. We'll give you a highlight of the new strategy, because some of you have asked us to do that because you're totally new. And also we have included, of course, the progress report of this year's work plan, and also status as it relates to the committee work plan and results framework. So without further ado, I'd like to please once again welcome everyone, and then go over to Flavia Bustreu, who is chair of our governance and ethics committee, who has then overseen the implementation of the governance reform. Over to you, Flavia.
Thank you very much, Helga, and greetings to all the colleagues of the Pmnch membership gathering from different parts of the world. I'm really delighted to share an overview of the governance reform, the progress we have made, and also share a little bit what is still left to complete, and have an opportunity to highlight some of the key transformation that we have in the new Pmnch and the expectation of how we will function working with each other differently. So I assume that there is someone that is going to help me with the presentation. So if you can have that in the meantime, that's it's the welcome. I think this is the first slide for today. That's it. That's me. I was already introduced. I'm delighted to see many faces and colleagues I already know, but also I'm delighted to see some that I don't know, and that is really great to have new members, and that was the essence of really looking at energizing Pmnch base. If I can have the next slide, please. The overview of the presentation will touch very briefly on the new 2021-2025 strategy for the Partnership for Maternal, Newborn and Child Health, but we'll dwell more with the governance reform objectives, and the consultations will also inform on the implementation of the governance reform, the process and the results. And as I said, we'll also share some thoughts looking ahead to complete the task of making the new partnership fit for the main purpose. The next slide, please. Helga will present that with much more detail than I will, but just to remind colleagues that have worked over last year intensively to develop a new strategy for the period 21-25 was which has identified as a main function of Pmnch advocacy, supported by campaigns and outreach, also supported very much and embedded in the partners' engagement, and clearly supported by the knowledge synthesis, because what the partnership will be about is intelligent advocacy with the knowledge that is required to do so. The next slide. This is familiar maybe to many, but just to recap that the new strategy has 3 key thematic areas: maternal, newborn and child health, including all the agenda of stillbirth, which is a legacy, if you wish, of the original partnership created in 2005. The second thematic area is sexual and reproductive health and rights, with all the thematics that are under this, particularly as this agenda has been under threat in the recent years. And then the third pillar of the third thematic areas is adolescent health and well-being, really related to the largely unaddressed needs of adolescents, the largest cohort of adolescents that we currently have in the world. The next slide, I don't intend to details, but just to say that in 2020, we completed an independent external evaluation, and the drive for the new strategy and for the governance reform were really the finding of that independent external evaluation, but also, as you can see there, a lot of discussion, consultations with the board, with the executive committee, with all the different constituencies, with the membership at large of Pmnch, which led at the end of December 2020 to a proposal that was entitled Harnessing the Power of the Partnership in a Digital Era, where we highlighted and agreed on the governance, the partner engagement, and the modality of operation for Pmnch going forward. Next. So just recapping what were the key findings that we heard from the independent evaluation and also from the consultation. And I'm focusing here only with those findings in regards to governance, not in relation to the overall strategy. But what we heard was that the Pmnch should reduce the complexity of its governance structure, which had become unwieldy, and also that we should develop a governance that is fit for serving the new strategies. That's the purpose, fitting the new strategy focus on advocacy. And also from the consultation, we heard that the board should consist of high-level champions. We also heard, and was very loud and clear from the external evaluation, that the Pmnch constituency-based structure is a core asset, is intrinsic to the success that the partnership has ever been able to achieve. And that also, we heard from the consultation that the smaller board will not equate to reduce incentive for participating, but rather we should look at other modalities such as committees, working groups, and community of practices that will allow a meaningful engagement of all partners. Next. So the 10 constituencies, most of you are familiar, but this to remind everyone that this is a quite unique feature of the Partnership for Maternal, Newborn and Child Health, in as far as, for example, we are the only alliance that has a very clear and articulated adolescent and youth constituency, which has been in place for the last 5 years. We are also the only alliance, global alliance, that has a healthcare professional association, dedicated constituencies, and that the 10 constituencies working with each other clearly are the essence of how we envisage also the governance under the new phase. Next slide. So this slide summarizes the before and after, and the attempt we had with the Governance and Ethics Committee and all your suggestions and work was really to streamline the board, to make it smaller with high-level champions that can be the extension and the reach for the high-level advocacy, create an executive committee that oversees the operations of the partnership, and also create 3 standing committees: governance, strategic advocacy, and partner engagement in countries, supported by 2 working groups that are for the accountability and for the knowledge and evidence. And as you can see, we streamline all the thematic work stream structure that were in existing before, as they are captured in the content of the work that the partnership will be doing. If I can have the next slide. One key feature of the governance reform that I personally am very proud, and I know also some of the young colleagues and some of the leaders in the call today are very proud, is that we thought about leveraging the power and the participation of young leaders across all the PMNCH governance. So we wanted to make sure that their participation and contribution was not a tokenistic, but it was really driving the agenda of PMNCH. And as you can see, you have young persons below the age of 30 in all, at the board level, at the executive committee, in the standing committees, and also in the constituency leadership of the academic, of the donors and foundation, of the global financing mechanism, of the healthcare professional association, of the private sector. And we still have some constituencies that are working on identifying who are the young leaders that will be. For example, the NGOs are setting up a steering committee, and they will come with the clear proposal. They haven't landed it yet. They're not arrived at a suggestion yet, and similar for the other constituencies like UN agencies and others. The next slide, please. So one key change in the governance reform is really the architecture of the board and the standing committees that you can see in this slide, that are really supported by a web, and the secretariat role is really to be that web and that connector and facilitators. And also, one of the things that is envisaged and is not yet panning out yet, but is coming, is the creation of community of practices, which will be entirely virtual, and that will be facilitated by the digital platform, which you are very welcome to explore in the web, and seeing even the partner zone that was created in the web to facilitate this digital and virtual interaction among ourselves as members. Next slide. Now, the governance reform implementation, as I explained, the structure and the vision was approved last December by the board meeting, and then we put in place a implementation process that had 3 phases. First, we focus on strengthening the constituencies and the executive committee. That was the first phase one. Second, we looked at strengthening the standing committees and working group and identify the leadership and begin identify the membership. And then we focus on phase three on the board membership. And we are still, as we speak, we are still finalizing that board membership of high-level champion, and we still have some of the nominations and the leadership roles that requires filling. Now, I'm aware of the time, and I have a series of next slides, which I'll ask Dina to go through quickly, just to, we prepare them for you to look through at your leisure time, and also for the people that cannot be participating to the seminar, to really see them in longer time frame. So the next slides, Dina, if you can just go through, they basically, you can go through, they basically explain the terms of reference that we develop for the leadership roles, the extensive discussion and consultations that we had, and also the webinars, how we used our, no, this is a bit too fast. Yes, if we can stay to this one. I just wanted to say we use fully our virtual connectivity, and also we course corrected as we were going ahead into the implementation of the governance reform. But in the previous slides, for anyone that is seeing this and is not, wants to see all the hyperlinks in blue, you can click and you will find the documents. So if you want to see the video tutorial, if you want to see the terms of reference, if you want to see particular the final composition of the leadership, you can find all of that. And also for all of you that are very skilled on the social, please see that during these days, the Pmnch web and the social media are putting out all the compositions of the different, of the executive committee, of the standing committee, of the working group. Please see them, retweet them, and distribute them. So my last slide is this, and is just to share with everyone that, of course, Rome was not built in one day. It took several days to build the capital city of the Roman Empire, and similarly to rebuild a fit for purpose governance of the Pmnch. We were envisaging this process to be completed in 6 months, but we still have some parts that remains to be completed. Number one, we still have a board vice chair under 30, which we have agreed we will identify, but we have to define the nomination process for it and identify the person. Then we also have to fill the outstanding leadership position within each constituencies. I have alluded to the young leaders in the intergovernmental organization, the UNGA and the NGO, and also some leadership in the standing committees and working group, and especially in those, the broad membership that is being now decided. And we'll have also some additional work to consider and reflect on whether the secretariat structure and design is now based on the need of the new governance and strategy, and continuing especially the work on the good governance and unconscious bias in order to make sure that the criteria of diversity and representation across many axes that we have committed to are really reflected, and completing the governance manual maybe by the end of this year. And what we are also thinking is that in maybe a year, we will have a light touch assessment as this governance reform really achieve what we wanted to see. And so my last slide is just a thank, and as all the picture of the colleagues that have been asked to serve in the leadership of the new Pmnch. And as you can see, I'm extremely proud. It's a very diverse picture across geography, across gender, across age, across specialties, and we are really excited to have all of them in the leadership role. Helga, back to you, and thank you very much.
Thank you very much. And we are going to go directly on to my presentation so that we get as much time as possible in questions and answers. And please continue, just use the chat box for comments, and we will also try to get answers there. So I prepared in the same spirit as Flavia. There are too many slides here too, but that is intentional for you to then review on your own, and also get back to us with specific questions if you have them. So let us run through this. Next slide. I want to give you a history of Pmnch and then the annual and financial report of 2020 with the key achievements, and then the overview of Pmnch's strategy, a 5-year strategy which has been approved last year, and then looking ahead on the 2021-2025 delivering of the results framework, a focus on 2020. And then just highlight on the COVID call for action, because that was actually very much reflective of what our focus has been. Then lastly, the financial position and the resource mobilization. So I will actually only focus on 10 of these slides, although there is 4 times as many. So let us now take you on this journey. Next slide. This is the history of Pmnch, and as you know, next slide, it was very much a part of the launch of 3 mergers of 3 different partnerships that actually came together, lowering their flag in order to understand that they needed to advocate for the continuum of care, which later on became the life course approach, and really recognizing the need to come behind MDG 4 and 5 at the time, because that was not going well. So key points for Pmnch, there was played a key role in developing the global strategy for women and children in 2010, and then in 2015, taking lessons learned from what one had actually successfully been able to accelerate between 2010 and 2015. We were then able to write the global strategy for women, children, adolescent health, leaving no one behind. And this is taking us into the SDGs, which reflected very much a cross-sectoral and multi-stakeholder approach. The next slide is really good guiding principles. We are partnership centric. We come together because we understand it is useful to come together and do more than we are able to do on our any organization is able to do on its own. We use the convening power of really bringing partners to the table, to discussing, creating consensus, and aligning and pushing the agenda more powerfully. It is driven by country demand and also regional priorities, and also, as I've said before, concentrates on the continuum of care and also the life course approach. Next slide. So this is highlights from 2020. Key achievements have been, next slide. First of all, we are hosted by WHO, and so therefore our financial report as well as our progress report is actually then sent together with hosted partnerships to the WHO, and this year got actually reviewed with extremely positive response, not only from WHO and Tedros himself, but also from member states. So just flagging this. Next slide. We also got a high score on the Global Health 50/50, where our gender equality assessments was assessed, and we scored very high, among the highest in the report. Next slide. This is really a snapshot of our what we have just started measuring in our reaches with webinars, with our knowledge briefs, and with our e-summits, and with also our different digital tools. So we in last year became much more digital in our operations, and we have then seen that we are able to reach many more not only members, but people, and influence to a greater extent than before. So we did see that some of our videos even reached 80 million and collectively had a reach of 1 billion. So this is something that we are increasingly measuring in order to understand the power of not only our partnership, but also the power of our advocacy and messaging using digital means. Next slide. What really reflects last year, and if I could just give you the elevator pitch on that, is we did what we did in 2019 as it related to positioning women, children, adolescent, and SRHR in the UHC resolution and declarations. And you will remember that in 2019, there was both the declaration at UNGA, and there was also a resolution at WHA, and there was also a resolution at the IPU. And we were able to, through our partners and our convening power, really influence that SRHR got included. Would not have got included. It would have been sidelined. We would have been lost in the principles of UHC, and it would not have been made explicit. We made a great effort into making that explicit and moving our partners in mobilizing for that. Likewise, last year. Last year, we saw that the COVID response was actually not focusing on women, children, adolescent, and women, children, and adolescent gains in the indicators were actually not sliding back, and gains made were being reversed. So this was critical for our partnership to really follow up and say, hey, we need to do something. And in times of crisis and in times of pandemics, actually one needs to be very explicit about priorities. And so women, children, and adolescent health was put in the forefront. And this was done throughout all of our actions of knowledge synthesis, of governance and partners to come together, and also our campaigns and outreach, which just reflected the establishment of the COVID-19 campaign, which had 4 strands, which I will come back to a little later. Next. You will remember that in our previous business plan, which was a 3-year period, 2018 to 2020, it focused on 6 focus areas, which we called the EVIC focus areas, was ECD, adolescent, SRHR, QED, empowerment, and also humanitarian fragile settings. These were our priority areas, and we had very much similar intent to really hone in on these focus areas and move the agenda as these was priority areas in the previous one. We have since in the new strategy decided differently to actually focus on 3, and I will come to that. However, what we did in 2020 and 2018 to 2020 was really honed in on the COVID response as well on these specific areas, but also moved agenda as it relates to these areas. Next slide. This is quality, equity, and dignity, sexual reproductive health. And the next slide is about empowerment, and then humanitarian and fragile setting, which gives you a little snapshot about what we focused on. Next slide. The resources available for us in 2020, because it was the last year of our business plan, and because of COVID, made it very difficult for resources to come to the level that we had budgeted and board approved, which was a comprehensive level at 15 million and then an essential level at 10 million. We were only able to reach approximately 8 million in 2020. And off of this 2020, we were able to use all of it. These lines here explain a little how our donors give us money, which is in a multi-year. And so there is a fine tuning in how much money we receive, and yet which portion of that money was earmarked for which year, which is a little confusing, but it is all possible to explain. Next slide. So the financial summary for 2020 was pretty much, we had a budget of 10 million, which we did not reach. Our resources were approximately 8 million, and we used really 98% of that funds. The reason we are able to use that, maximize on implementation, is because many of our donors give multi-year funds. Next slide. The next slide is about the strategy and the focus. Flavia has done some of it, so I will run also very quickly through this. Next slide. Here's a vision mission, which was much more tighter and made explicit to that we are about women, children, adolescent health. And our mission is really about advocacy and amplifying the messages from partners and driving change for women, children, adolescent health. Next slide. You will have you will recall this slide that Flavia also presented on our focus areas. So we no longer have the 6 EVIC focus areas, but the 3 focus areas of maternal, newborn, and child health, SRHR, and adolescent health and well-being. Next slide. So our functions and the new Pmnch is about advocacy, and it's using advocacy to drive change. And we will be able to do this influencing better financing, better policies and laws, and better service delivery, or more coverage of service delivery through our advocacy. And our advocacy function is then partly about campaigns and outreach. It's about partners getting together, and it's about knowledge synthesis and the power of making that knowledge, not only putting it together, but making it known to drive action. These are kind of pillars, but that is not the new Pmnch. The new Pmnch is the next slide, which kind of makes these all orchestrated, strategically orchestrated in order to function more together than individually. So it is about digital tools in bringing campaigns at the same time as you convene partners, at the same time as you use knowledge in order to really advocate and drive change, and then reach our outputs and outcomes as they relate to contributing to better policies, better financing, and better service delivery. So next slide. This is also how each constituency does not function on its own. It functions together in a strategic, orchestrated fashion in order to really come together and do more together than any constituency, any partner can do alone. This is what this tries really to demonstrate, how there is a lot of actually staging, there's a lot of planning, there's a lot of convening in order to then not only move together, but strategically sequence it so that we become powerful in our partnership. Next slide. This is the theory of our change. On the left-hand side, you have a problem statement. The right-hand side, you have the SDG goals for women, children, adolescent health. In between is what we will do as objectives of Pmnch, which are the 3 focus areas. Our functions are advocacy, which is built and entails from knowledge synthesis, partner engagement, and campaign and outreach in order to contribute to better and influence policy change, in order to influence more and better use of finances for women, children, adolescent health, and also service delivery and empowerment, self-care, and care-seeking behavior. So this is really the theory of change. Now, the next slide is really what I've already said about advancing these focus areas in order to influence policy and finance and services. Next slide. is where we're coming now to a results framework as well as our work plan for 2021. So next slide. This is our results framework, and some of our donors have helped us with actually insisting on that we're able to measure some of our effect in our theory of change. So what we're doing now is that, just as Flavia has said, our committees and standing committees are going to be convening. Our outputs are going to be then fed into how they successfully contribute to the outcomes, and the outcomes will then lead to influencing policy and finances and service change. So these are really 30 low and middle income countries making policy financing and service commitments aligned with the Pmnch call to action in order to move on MNCH, SRHR, and adolescents, and focusing on then, of course, equity. And then also how do we use global political commitments, and these are at line with the declarations or resolutions in order to really move on this agenda and create that kind of leverage that you need in order to move at national and community level. Next slide. So these are just examples. This is the Strategic Advocacy Committee, and what they will do is they will look at the call for action and define actually priorities in how to really leveraging the messaging and how best to orchestrate the outreach, and both at global and regional level, in order to then move. They will need to work closely with the partner engagement countries in order to ensure that that change actually happens in countries and on the ground. Next slide. The partner engagement country committee will then need to see how to involve our partners at country level in order to orchestrate the added value of Pmnch, in order to orchestrate citizen hearings, in order to orchestrate parliamentarian hearings, in order to orchestrate media outreach, in order to then influence and get this movement on that more focus needs to be smartly in smart investments on women, children, adolescent health. Next slide. The knowledge evidence and also the accountability working group will look at what is it that we need of evidence in order to move our agenda. Is it an investment case on women, children, adolescent health in order to ensure financing? Is it economic analysis? Or is it the consequences of COVID on women, children, adolescent health? We need to be smart in the way that we use and synthesize knowledge in order to feed into the advocacy of our messaging. Next slide. So these were really just samples of the way that we're going to deliver on coming together and moving the agenda and informing each other better, so that we equip each other better, and also but come together better in moving and in a meaningful way to influence necessary policy, financing, and service delivery. What we've done last year is develop the COVID call to action, and I'm going to run really fastly through this. What we are going to do is we're going to ensure that you have links to the places on our website for the strategy, for the governance reform, and also the call for action, so that you can go into detail about this. Because what a lot of our advocacy is to harnessing countries that actually commit to this call for action, which focuses and really makes the pitch that you need to make explicit dealing with women, children, and adults now during your COVID response. So next slide. So these are really where we have included the COVID call for action in all of our summits, in all of our social media, in all of our, we have gathered the evidence as it relates to impact of COVID on women, children, and adolescents, as well as the benefit on explicitly dealing with women, children, and adolescents in a COVID response. So these are all the ways that we're trying to kind of hit the preparedness plan of necessary in order to move the agenda. Next slide. The COVID call to action has 7 asks, and you will see these are carefully designed. There's evidence behind each one of these that is synthesized and is provided on our website. So every one is something that needs to take place in order to create change for COVID response. Next slide. We are now aligning with partners in order to then make these known, and also that the commitments and the responses that they're doing at country level are really in line with the 7 asks, so that we are helpful in sharing this knowledge of evidence base for action. And this is just a summary of the countries that are committed and how we plan to follow up this commitment in line. These are commitments that are made for women, children, and adolescent health, but are in line with the evidence that relates to the 7 asks. Next slide. So that concludes a little bit on the gist of the COVID call for action. There's just a couple of few slides here on the financial position of 2021 and what we are doing moving forward. So next slide. So currently we have, our budget is still 10 million and our comprehensive budget is 15 million. We have, as of June 2021, only secured 5 million in funding and with around 2.6 million pledged or under consideration. So there is a gap of 2.5 million in order to reach the essential budget. And this is something that we are then looking into seriously in trying to gap. Our situation has been challenging because of the COVID situation, which has caused really havoc for funding of many important organizations and also items. But we also then think it is important to see COVID and women and children and adolescent health in together. So this is something that we've really increased our resource mobilization. The gap is also there for 2022 because we have not really locked in multi-year fundings from our donors. This is still under negotiation as we speak. Next slide. So this is an overview of all the sequential funding, as well as the governments and donors that give us funds. There is a summary table in next slide, which I'd like to go to. So over the last 15 years, Pmnch has been funded by almost 25 different donors. Our donor reporting, it has, I think, over 50 points per year, which is massive. So COVID-19 has affected our ability to secure resources. And so we're at the 8 million level. And this will we will have this kind of similar funding gap in 21 and increasing in 22 if our multi-year fundings don't come through. So we are now trying to look at innovative ways of securing new grants. We are exploring new donors. We are exploring with partners how to cost share deliverables, how we can get partners to offer partners in kind contribution, staffing consultants from partners, and then budget and reductions, elimination of travel has helped enormously, and lower cost expenditure options. So next slide. So seeking partner engagement and support efforts are being a result. More work is needed to achieve the strategy, seeking inputs from partners, identifying funding opportunities, offering staff secondments, hire experts directly, and so forth is something that we are then leaning forward and will take up with the executive committee. Next slide. So this is my last slide. It's the calendar of Pmnch's governance events. I would just want to share with you that we have, next slide is really a planned that the executive committee will meet again at the intersection between September and October. They will also then now, different than earlier, meet after the board because they take directions from the board and strategic inputs from the board. Before it was the opposite. And now it is because we have now a board of champions instead of an operational board. So this will then be around, these dates are tentative. They have not been board approved or the executive committee has not confirmed them. In between here, there will be an ample amount of standing committee meetings and working groups, as well as constituency groups. I just have to share with you that the Secretariat supports a lot of activities that each of the 10 constituencies conduct, as well as support to the standing committees. So the Strategy Advocacy Committee, the Partner Engagement in Countries Committee, and the Accountability Working Group, and also the Knowledge and Evidence. The Governance and Ethics Committee, which we work very closely with in not only designing but also implementing the governance reform, has established a good governance and management working group, which we also support and which there is very much exciting work around. I think that was my last slide. This is us. This is you. This is us. We have the board meeting in Nairobi during the ICPD 25 on the left-hand side. And we've got the Secretariat, which is, I'm proud to say, a very committed group of highly professional, diverse and brilliant team that I'm so honored to lead. So with that, thank you. And let us now open to a little questions from your side. Please feel free to raise your hand. Okay, we've got Mamadou. Mamadou Waba.
Yes. I'm Mamadou Waba from Egypt. I'm so delighted to see that your strategy is advocacy, but not only that, it's action and impact-oriented advocacy strategy, which is very, very good. I'm also glad to see that you are working at different levels of from the top to the bottom of the pyramid, which again is a very good strategy to do that. Now, the targeted countries in the year 2021, I haven't seen the Middle East and North Africa countries among your list. And in this area, we have more than 100 million adolescents with very distinct, different characters, needs, behaviors, and so on. And they need a lot from you, and I hope you could consider adding our region to your arena, which is wonderful. Thank you.
Thank you for that. I will let's suggest that we take a number and then respond, but noting that your input will also go to the committees and working groups, so not to only end them here. Jeannie and then Anna Stavdal.
Thank you for a fabulous overview, trying to simplify it as much as you can for our ears, because I think it's a very complex look at a very complex organization and trying to make it clear. You did an excellent job for all of it. I think all of us will be happy to go back and review again. One of the questions I have is just the timing of the meetings is critical, and setting up the timing. Are we going to have support so that we can easily see? Because I think all of us are probably setting our calendars aside, and this is a priority for us. So any suggestions on when we'll be hearing about meetings and how to work on that?
Thank you for that, Jeannie. We'll come back to that in a second. Anna?
Yes, hello everyone. I'm joining you from Oslo, Norway. I'm the incoming president of the World Organization of Family Doctors, a new member of this initiative. So I just want to express enthusiasm over what I've heard and state also that we are working on, as Wonka, how we can engage in the work you're doing. So I'm looking forward to future meetings, and I'm sure we'll find a way to find out how we can contribute. So that was all. More a comment and a thank you than a question.
Thank you for that, Anna. Okay, I don't see any more hands up, so let's take this. Jeannie, let's start with yours. We will make all of this available on our website. We'll also make available how to get in contact and who to get in contact with if there's any questions. We will also work with the chairs of each of the constituencies as well as the standing committees in setting up dates that we will then also make available. So I think the standing committees will, now get together and come together in that. So that is also a little in the making still. In regards to the Emerald region, absolutely. This is something that we would need to work with also you as partners in understanding and mobilizing commitments, and also making them known and seeing how we can support our partners in the region in the way that Pmnch really has the power of convening partners and driving change. So let us please get in touch and so see how we can mobilize the commitments according to the COVID call for action, and also follow up in a meaningful way.
Thank you.
Flavia, do you want to add anything here? Flavia, you're still on mute. You're still on mute.
I just wanted to add, Helga, a special thanks to Mamdouh, and also to say that we at the Governance and Ethics Committee had noted that, for example, among the nomination for leadership and for participation of the different membership, there were 2 regions that were less present, and one was definitely the Middle East that you raised, but also the Western Pacific region. So I just like to make an appeal to all the colleagues that are here, that if you are from those regions, or you have colleagues and friends and other organizations that are from those regions, please help us engage and get engaged, because we did see that the roots of the work of the Pmnch needs to become stronger in those regions. Thank you.
Thank you for that. Any other questions? Okay, please note, if I may, that the partner engagement working group last year, which was called the Country Engagement Working Group, really envisaged, which got adopted into our strategy, that Pmnch needed to make available useful knowledge briefs and knowledge synthesis and tools that are useful to all partners in order to drive change. In addition to this, we need to be able to enter and maximize political platforms or platforms that drive change and engage in a strategic way with them in order to then really maximize the implementation of our strategy. The other is there might be some deep dive that is needed in some countries where we have small grants in order to do citizen hearings, parliamentarian hearings, media outreach, or support the multi-stakeholder platforms. And in that, we have emphasized that it is important, imperative that we ensure the meaningful engagement of constituencies and partners that have not usually been invited to the table. And so civil society, youth-led organizations, and so forth, that to make it implicit. So I think a lot of this in the design needs to actually happen with our partners in countries, because the Secretariat will not zip out and zip in. This is through our partners. This is a partnership-led, partner-led partnership, and it's partnership-centric. So we need to find out what is the best modality in each country and how we can get the best strategic mix of partners in a sequential and strategic manner. So I hope that that is useful. Please follow closely on our website. We will have additional information. We will come out with our e-blast, which is our newsletter, and I will be writing follow-up and also informing all our members, the focal points on our membership list with regular updates as it relates to the operations of Pmnch. Priscilla, you have your hand up.
Yes, thank you so much. My name is Priscilla. I'm representing the Youth Harvest Foundation Ghana. We are a youth-focused organization. We recently came across the Pmnch, and we registered to be members of this fraternity. But it seems that we are yet to be approved. I don't know what the processes are. Besides that, we also focus on adolescent reproductive health and rights, and we currently are part of a national level advocacy group that is advocating for the government of Ghana to adopt and implement comprehensive sexuality education into our education curriculum. And I saw the list of countries that you work with, the partners, and I wanted to find out how do we become part of these partners that you work with in Ghana. Thank you.
Priscilla, thank you for that. Can you put your email in the chat box, and then someone from the Secretariat will follow up immediately with you and give you a status of your membership, and also give you information of how you can take part in the adolescent and youth constituency, which I must say is a vibrant and very exciting constituency, as well as our 9 other constituencies.
Great. I'm grateful. Thank you.
Okay. We're a little over the hour. Any other questions? Please feel free to get in touch with us, either by email or WhatsApp or through our website. And we stand ready to support you in any way that we can. And we will look forward to engaging and including you in this new and revised, exciting partnership.
Thank you very much, Helga and colleagues. Thank you.
Thank you. Great.
Thank you very much.